My name is Sierra Clark and I'm a student physical therapist assistant from Jeff State. Today we're going to be talking a little bit about sepsis. So sepsis is the body's response to an extreme infection. This is a life-threatening condition that can cause organ failure and death if not recognized and treated quickly. So sepsis occurs when an already existing infection causes a chain reaction throughout the body. So the difference between just an infection and sepsis is that an infection occurs when germs enter a person's body and lead to illness, organ and tissue damage, or disease. If that infection goes untreated, then it can cause the life-threatening condition known as sepsis. So some signs and symptoms of sepsis include disorientation and confusion, shortness of breath, high heart rate, fever or feeling very cold, extreme pain or discomfort, and clammy or sweaty skin. Some tests that can be run to diagnose sepsis include checking a patient's body temperature for a fever, low blood pressure, and increased heart rate, as well as lab tests that can be run to check for signs of infection as well as organ damage. So sepsis requires hospitalization for treatment. It also requires antibiotics in order to treat the infection that caused sepsis. And with treatment, you need to maintain good blood flow to the organs and treat the source of the infection. So the time between recognizing sepsis and getting treatment can be a life or death situation. When a septic patient comes into the hospital, doctors treat them with antibiotics as soon as possible. Many patients receive oxygen and IV fluids to maintain blood flow and oxygen to the organs. Other types of treatment can include a breathing machine or kidney dialysis, and surgery is sometimes required to remove the tissue that was damaged by the infection. So the course of the infection starts with sepsis, progresses to severe sepsis, and then finally becomes septic shock. So as sepsis progresses, the blood flow to the vital organs decreases, which leads to organ failure and tissue death. Most healthy people can recover from mild sepsis, but the mortality rate for patients in septic shock is only 50%. As well as an occurrence of severe sepsis may place a patient at a higher risk for developing infections in the future. So, patients with severe sepsis are susceptible to developing neuromuscular complications. These complications can be attributed to general inflammation and immobilization and can lead to significant muscle wasting, polyneuropathy, and or myopathy. So physical therapy can help prevent or treat the inflammation, immobilization, and muscle wasting. Therapy is also related to a decrease in the length of hospitalization, functional decline, as well as preventing bed rest deconditioning and increasing pulmonary and tissue aerobic capacity. So again, sepsis is when an already existing infection causes a chain reaction in the body. And when an infection is not healed, then it can cause the life-threatening condition known as sepsis. And the difference between, or the time difference between recognizing sepsis and getting treated for sepsis is oftentimes what determines if the patient will recover. Thank you for listening, and I hope that this helped you gain a more comprehensive understanding of what sepsis is.